We have witnessed this past year the importance of cooperating, negotiating, and compromising. They are essential to the proper functioning of our parliamentary system. I want to thank the honourable members for their attention et j'aimerais aussi remercier l'honorable député de Salaberry-sur-Roi pour nous avoir amenés à ce point-ci avec les masques. And I also want to thank all the members with the cooperation that has taken place, and it really shows that Canadian democracy is working strong and people are working together. I'm very proud to be a part of this chamber. Merci. Tabling of documents. Conformément à l'article 15, conformément à l'article 15.3 du Code régissant les conflits d'intérêts des députés, il est de mon devoir de déposer sur le bureau la liste de tous les déplacements parrainés des députés pour l'année 2020, ainsi que le supplément reçu du commissaire au conflit d'intérêts et à l'éthique. Tabling of documents, the Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you, Mr. Speaker. Pursuant to Standing Order 36 bracket 8A, I have the honour to table in both official languages the government's responses to 7 petitions. These returns will be tabled in an electronic format.
Very good. Introduction of government bills. Déclaration de ministre.
Statements by ministers.
The Right Honourable Prime Minister.
Thank you, Mr. Speaker. In February last year, the coronavirus disease discovered in 2019 gave us a new word, COVID-19. But even as COVID-19 took hold of our planet, even as this new word took over our lives, we found ourselves talking about other words, too. About words that weren't new at all. Sacrifice and solidarity, compassion and community. When the pandemic hit last year, these words, words that have defined Canadians for generations, were suddenly given new meaning. It has been a tough year, a heartbreaking year, but it has been a year that we have faced together, and that is something we must never forget. Mr. Speaker, on this National Day of Observance for COVID-19, we remember the people we've lost, grandparents and parents, brothers and sisters, friends and colleagues. Each one was loved. Each one was special. Monsieur le Président, la pandémie
Mr. Speaker, the pandemic officially turns 1 today. March 11th, 2020 will always be a date for which there will be a before and an after. For family members and loved ones, each death also marks a before and an after. Today, we remember the people who have lost their lives to COVID-19. They are no longer with us, but they are in our memory. Since the major wars of the 20th century, there is a sentence that we use often and that we can use for those that we lost this year during the pandemic. We will remember them.
Mr. Speaker, a year ago, Canadians were asked to stay home and stay safe. And yet, even apart, or perhaps because we were apart, our communities became stronger and stronger. Businesses stepped up to produce PPE when we needed it most. Some went from making hockey masks to face shields. It doesn't get more Canadian than that. Students and teachers learned how to do school online, and kids did the dishes while they were doing their homework. Young people across the country stepped up to help their neighbors, to serve their communities. Essential workers made sure the shelves were still stocked with food People cheered from balconies in solidarity with healthcare workers, the heroes of this pandemic. Brave women and men in the armed forces answered the call of duty for Indigenous communities and for the greatest generation now in long-term care homes. They were there for our parents and grandparents. And through that service, we saw clearly that for every senior in Canada, we must do better. And I know that we will. Malgré tout, il y a de l'espoir à l'horizon.
There is hope on the horizon. Vaccination is ramping up. Millions of doses are on their way. It is not time to give up. Mr. Speaker, while people continue to make efforts, I know that they are reassured when they see all of their leaders working together, beyond partisanship, beyond party lines. We are in the midst of an unprecedented crisis. It will take the talent, the know-how, and the ideas of all Canadians to see what the future brings. We will not be able to rebuild a fair economy for everyone if we are divided. We will not be able to develop major societal projects if we refuse to listen to one another. Over the past year, we have worked together to move forward. And this year, we will continue to work together to rebuild.
Compassion and community, sacrifice and solidarity. This is where we find meaning in the depths of grief. This is our light through a dark time. Every Canadian we lost to this virus will be remembered. Every shift done by a frontline nurse, every mask made by a Canadian worker will not be forgotten. We are stronger together, today, tomorrow, and always. Merci, Monsieur le Président.
Thank you, Mr. Speaker.
The Honourable Leader of the Opposition.
Mr. Speaker, today we recognize a somber National Day of Observance for COVID-19, a virus that has caused a crisis of historic proportions here in Canada and around the world. More than 22,000 Canadians have died from COVID-19. Hundreds of thousands have fallen ill, and millions have lost jobs or have had their work severely cut back. Des Canadiens sont partis sans voir leur famille ou leurs proches pendant des mois. Plusieurs parents se sont démêlés pour aider les enfants à apprendre à la maison. Les Canadiens doivent également faire face à une série d'effets secondaires liés à la pandémie. Plusieurs travailleurs s'inquiètent pour la santé mentale de leurs collègues. Des milliers d'opérations contre le cancer ont été retardées. Les taux d'abus de drogue et d'alcool ont aussi augmenté. La violence conjugale et la pandémie de l'ombre de la COVID-19. In British Columbia, there have been 60% more deaths from the opioid epidemic than from COVID-19. Increasing rates of domestic violence have been the shadow pandemic this past year. Youth mental health, presenting as anxiety or eating disorders, are alarmingly on the rise. The true cost of this pandemic on the lives and livelihoods of Canadians of all walks of life has been staggering. And yet, after a year, Canadians still aren't sure when we can expect life to get back to normal again. We all want that. When we can go back to work regularly, see our classmates in school like we used to. When everyone can expect their vaccinations. Les conservateurs veulent que le gouvernement réussisse. Tout est lié au déploiement des vaccins. Notre nation et notre relance économique en dépendent directement. Nous devons tout mettre en œuvre pour que les Canadiens retournent au travail dans tous les secteurs et dans toutes les régions du pays. Les Canadiens ont besoin que le gouvernement agisse, notamment pour arrêter la propagation des nouveaux variants. Our frontline healthcare workers are exhausted. Nurses, PSWs, physicians, and caregivers have put it all on the line for us this last year, and Canadians appreciate your efforts. Rebecca and I saw their hard work and dedication firsthand when our own family had our experience with COVID-19. We want to thank the dozens of healthcare workers at the Brewer Park Assessment Center for working with us. Merci aussi à José Gauthier, notre infirmière publique. Thank you, José.
Thank you, José.
Our frontline and essential workers deserve our thanks and praise. They also deserve our efforts to ensure that we can provide them with more support and certainty in the future. And in the present, they deserve to know when they can expect their lives, which have been turned upside down perhaps more than any others, when those lives will return to normal. Small businesses that have been hanging on by a thread also deserve to know when Main Street can finally be able to breathe a sigh of collective relief. Les Canadiens ne savent toujours pas quand ils pourront recevoir leur première dose
when they will
de
be able
vaccin.
to get their first dose of the vaccine.
Pendant ce temps, nos voisins du Sud
Meanwhile,
vont relancer leur
our
économie
neighbors on the
car plus
south
de
will
300
be able
millions
to
d'Américains
restart
vont
their
être
economy
vaccinés
because over 300
d'ici
million
Mai.
Americans will be
We've
vaccinated
worked
by
together
May.
to help Canadians in this crisis. And as we've wanted to see more effective programs, we've still got the money and support out the door and worked on fixes after. Like many Canadians, we're frustrated by the slower pace of vaccines than elsewhere, but we want the government to succeed for the health, well-being of Canadians, so that we can get our lives back to normal, so that we can address the unemployment, the inequality, and the strain caused by the crisis. We must also recommit as Canadians to ensure that our country is never again unprepared. We must learn the lessons, build capacity, and ensure a swifter and more effective response in the future. Aujourd'hui, alors que nous observons les effets de la COVID-19 sur le
When we see the
Canada,
effects of
il est
COVID-19 on
important de
Canada,
travailler ensemble
it is
pour
important to
améliorer
work
le plan
together
de vaccination
to improve the
et
vaccination plan
la relance économique.
and the economic
But today,
recovery.
We pause, give thanks, remember, take a collective breath, and then redouble our efforts to beat COVID and get life back to normal. Let's gather up our true patriot love to ensure that Canada conquers COVID and emerges united and more stronger than ever before. Merci beaucoup. Thank you, Mr. Speaker.
Thank you very much.
L'honorable député de Belleuil-Chambly.
The honourable member for
Merci, Monsieur le
Belleuil-Chambly.
Président.
Thank you,
C'est
Mr. Speaker.
avec le symbole de la rose blanche
It is with the
dont je me suis
symbol of
permis
the
d'amener
white rose, which
un
I
exemplaire ici que
took the liberty
le
of
Québec
bringing
a choisi
today,
aussi
that
aujourd'hui
Quebec has
de
chosen
déclarer une journée de commémoration.
to
Parce que
declare
même
today
si, en temps
a
normal, on aurait pu
day of
croire que la
observance.
commémoration suit le drame,
because
il dure maintenant depuis déjà tellement trop longtemps
it has been far
qu'il
too
fallait
long
procéder.
that this
Il
crisis
fallait
has been
déjà
underway, and we can't wait for the
dire à
end of
nos
it
gens,
to have a day of observance.
dire
We
à toutes
have to
celles et à
say
tous ceux
right now
qui ont perdu
to
un
all of
proche
those who
que
have
nous
lost a
sommes
loved
déjà
one
avec eux.
that we are
Plus de 10
with
000
them now.
personnes au
Over
Québec,
10,000
plus de
people
20
in
000
Quebec
à
and
travers
over
le Canada
20,000 throughout
ont
Canada
perdu la vie à
have
cause
lost their
de la
lives
COVID-19.
to COVID-19.
Près de 300 000
Over
personnes ont contracté la
300,000
maladie au Québec.
people got the disease
Ce ne
in
sont pas des chiffres.
Quebec. These are not
Ce sont
numbers.
des visages,
These are faces.
ce sont des personnes,
They are people.
ce sont des présences.
There are presences that are no longer present.
Et comme mes collègues, je veux souligner
And like
la
my
reconnaissance
colleagues,
que
I
nous devons
want
avoir
to
à
stress
l'endroit des
the
travailleuses et des
recognition
travailleurs de
that
la
we must
santé.
feel and the appreciation that we must feel for
Des gens qui sont
healthcare
aussi dans le
workers,
monde de l'enseignement, dans les
for
services de
people
garde.
who also work in
Et 3
education,
jours
in the
après le 8 mars,
schools,
je me
in
permets de rappeler
daycare services as
que
well.
ces premières lignes sont souvent occupées
And
par des
a
femmes.
few days after the 8th of March, I would like to
J'ai une pensée
remind everyone that
pour
those front lines are mostly
les plus
held
vulnérables
by women.
que la pandémie a rendu encore plus
The
vulnérables.
pandemic has made the most vulnerable among us even
Les
more
gens qui vivent
vulnerable.
dans l'isolement, dans la
People who
pauvreté,
are
dans
isolated, who live in
l'anxiété,
poverty, who suffer
qui
from
souffrent
anxiety,
encore davantage et qui sont rendus plus
are
fragiles
suffering
face à la
even
maladie.
more and are made even more vulnerable by
Le
the
système de
pandemic.
santé qui est à bout de souffle.
The healthcare system
Les finances publiques qui
is
sont
in great
mises à mal.
difficulty. Public
La peur et la
finances
détresse
as well.
qui semblent être devenus le
fear
quotidien
and distress
de
have
tellement d'entre
become
nous, avec chaque fois
daily
un bout
for all
d'espoir
of
qui
us.
est retardé, incertain,
We keep waiting for uncertain
Les aînés.
bits of hope.
aux prises avec plusieurs
Seniors
détresses.
Are distressed in many
Ils
ways as
sont les
well.
plus fragiles, ils sont ceux
They
qui,
are
au
the
premier
most
chef,
fragile
meurent le
among
plus
us,
facilement
and
de
they
la
are
maladie.
those who
Ils sont
are at
les
most
plus
risk of
isolés.
dying from
Ils sont
COVID-19. They are the
ceux
most
qui souffrent le
isolated,
plus de la perte de
and
leur
they
pouvoir
suffer the
d'achat qui
most
recule.
from their diminishing
Mais c'est
purchasing
plus fort que
power.
moi, je ne suis pas capable de m'empêcher de
But
vouloir
I
trouver quelque
have
chose de
to
positif.
try to find something positive in all of this.
On a tous
I
évidemment,
can't help it.
ou on connaît tous évidemment
We
quelqu'un qui a perdu la vie
all
aux griffes de
obviously
cette maladie-là.
know someone who has lost
Mais on a le droit de
their
se dire
life
qu'éventuellement,
to
on a
this
le
disease.
devoir, on va avoir l'obligation de comprendre ce qui s'est passé, de
We
décortiquer
will
ce qui s'est passé.
be bound to
De s'en remettre à la
understand
connaissance
what's
et à la
happening and what has
science.
happened, to turn to
Pour d'abord
science, to
venir
be
à
able
bout de la maladie.
then to overcome,
Mettre un
this
terme à
disease.
tout ça.
to put an end to all of this.
Ensuite, déployer de la bonne manière des efforts
Then,
pour
it will be our
relancer en
duty
effet l'économie.
To
Pas
put in
l'économie
place
comme colonne de
measures
chiffres.
to ensure that
L'économie comme
there's economic
moyen
recovery.
de
And I'm
se
not talking
réaliser
figures.
comme personne,
I'm talking the economy as
de
a means
reprendre
of
pleinement
self-realization, for coming
reconstruire
fully
notre
back to life,
capacité vaccinale, médicale et
rebuild our
sanitaire,
capacity to vaccinate
Rebâtir
people, our
une économie
healthcare capacity
dont on
as well.
saisira
Rebuild an
l'occasion pour la
economy
rendre plus riche et plus
that
écologique
will
à la
be
fois.
richer
Et j'espère
and
qu'on aura
greener
compris,
at the same
plus
time.
généreuse,
And
plus
more
égalitaire.
generous. I hope that that lesson will have been
Renforcer
learned.
bien
More
sûr notre système
egalitarian.
de santé
We must
sans
strengthen
biais
our healthcare system
idéologique.
without any
Faire
ideological
le bilan de
biases.
ce qu'on aura fait de bien,
We will have to look
mais
back and
aussi
see
de
what
ce
we
qu'on
did
aura
well,
fait
but
moins
also
bien.
look at what we didn't
Aujourd'hui,
do
par
quite
contre,
as well.
d'abord,
Today,
avant tout,
however,
toujours,
first and
La
always, we must.
la compassion qui doit venir avec
Show
le sentiment de
compassion.
privilège que nous avons, nous,
It is
d'être
compassion that is
capables
linked
d'aider
to this sense of
et d'être en
privilege that we
mesure, par
have
notre
to be
santé,
able to
d'aider
help
ceux qui ne
because we
bénéficient
are
pas de ces
healthy
privilèges-là.
and because we have privileges and we can
faut
help those
laisser
who do
notre
not
cœur
have
se
those
porter
privileges. We have to
vers
feel it
ceux et celles
in our
pour qui,
hearts. We have to
après
feel
avoir lu un peu
in our
partout, ça va
hearts
bien aller,
of the people
ceux
who
et celles pour qui
have
ça n'a pas si bien
heard
été.
that things are going to get
Que
better,
notre cœur se porte vers elles
But
et vers eux.
who in their own experience have not seen that. It has not gone better for them. Thank you, Mr. Speaker.
The honourable member for Burnaby South.
Merci, Monsieur le Président. Thank you very much.
Thank you, Mr. Speaker.
When we acknowledge and remember today as the anniversary of this pandemic, it requires us to reflect on who has been impacted by this. We've all been impacted. We've all felt this pandemic in some way. But I want to take a moment to think about those who've been hardest hit by this pandemic, those who have felt the brunt of this pandemic. And it is with great sadness when we reflect on who felt this pandemic the most and who bore the brunt of this pandemic, we come up with the answer that our seniors, particularly seniors living in long-term care, were those who bore the brunt of this pandemic with the worst conditions and with their lives. And it is a national shame that that's the case. I think about so many people, so many loved ones who were lost when their family could not be there with them in their last days. They were lost and families couldn't grieve their loss. And so many preventable loss. It's hard to really think about what losing 22,000 Canadians mean. But there was an incredible event on the front lawns of Parliament that really illustrated what that meant. Normally, when we see protests on the front lawn of Parliament, it's about the presence of people, how many people show up. But in this protest or in this moment, it was about the absence of people, and there was empty shoes laid out that reflected and represented those that we've lost. And we lost so many loved ones. And I think about a man I met in Windsor who talked about his father, who, with a lot of difficulty, decided needed to go to long-term care because of his complex care issues, was in long-term care, got COVID-19 right around the time when the vaccines were announced, and ended up losing his life. And to this day, his son is haunted with the thought of what would have happened if my father got the COVID-19 vaccine. Maybe he would still be there. Donc, quand on pense de cette pandémie, on doit réfléchir sur qui a été frappé le plus.
This pandemic and the statistics, we have to think about who this hit hardest, and it's a national shame. It was seniors in long-term care who were the hardest hit by COVID-19. And we always have to remember that those deaths were avoidable deaths. If the decisions had been made, if vaccination had been sped up, lives could have been saved.
Frontline workers.
So we need to remember that.
Whose courage was incredible in this pandemic, who put their lives in front of this pandemic, who put their lives on the line. We are so thankful to them. But they deserve more than our thanks. They need to be properly cared for, properly compensated. And we will continue to work for that. Il faut aussi rappeler que c'était
les travailleurs de première ligne qui étaient aussi frontline workers who were also
les travailleurs
the hardest hit.
Les manières de travailler de première ligne.
All frontline workers, not just healthcare workers, but also those who work in stores.
Toutes les façons,
in all kinds of ways. They're the ones who are the true heroes of this pandemic.
I also think about Indigenous and racialized people who have been amongst also the hardest hit. Indigenous communities who live with a constant fear that an outbreak would be devastating to communities that have faced historic and ongoing lack of access to healthcare, and that a pandemic would be devastating to Indigenous communities. To live with that fear and that worry has been just completely wrong. And why we need to make sure in our response to this pandemic and in the vaccination, these vulnerable communities receive the vaccine as quick as possible. And I also want to reflect on how racialized people have been hard hit by this pandemic. That the workers in factories, in logistics and transportation and warehouses, the workers that brought food to us, that continued the supply chain, these workers could not work from home. They did not have that option. And as a result, they were amongst those who were more likely to get infected by COVID-19, who felt, again, the brunt of this pandemic. And in thinking about the impact of this pandemic, we know that it has not only meant the terrible and horrible loss of life, it's also meant a loss for jobs, loss for businesses. Small businesses have had to shut down. And specifically, when we talk about loss of jobs, we know that women have been disproportionately impacted. Women have been more likely to have lost their jobs by this pandemic. And so in our recovery, so that we never let this happen ever again, ce qu'on doit faire pour la mémoire de ceux qui ont perdu leur vie dans cette pandémie, c'est de s'assurer
qu'on prend des mesures
spécifiques et concrètes pour prévenir
les mêmes résultats dans l'avenir.
Donc, premièrement, on doit prendre soin de nos aînés en enlevant le profit dans les centres de soins de longue durée et s'assurer qu'on a des standards, des normes nationales pour nous guider
to guide us.
Rassembler tout ce qu'on a appris pendant cette pandémie pour s'assurer
We
que nos
need
aînés
to benefit from
reçoivent
everything we've
le meilleur
learned in this
soin
pandemic
possible.
to make sure that our seniors get the
We need to
best
make
possible
sure that
care.
moving forward, we remove profit from long-term care so that our seniors no longer bear the brunt of any future outbreak, pandemic, or serious event. Our seniors need to be protected, and there are clear steps we can take. We know that frontline workers need to be paid a dignified salary so they can do their work and so that they are protected. And we know that when we have good quality of work, good conditions of work, it directly means better care for our loved ones in long-term care. We need to also make sure we are building resilient communities where we are investing in childcare so women can return to work. We need to make sure we build a capacity to produce a vaccine in our own country, ideally owning that publicly so that we were never in the same situation we were at the whims of international logistics and supply chain issues. Pour prévenir les mêmes impacts de la COVID-19 ou une pandémie dans l'avenir, il faut s'assurer
pandemic in the future. We need to make sure that we make investments in childcare to ensure that women who were the hardest hit, make sure that they can go back to work. We need to have a domestic vaccine production capacity as well, and we need a crown corporation that Canadians control to produce vaccines and essential medications. It's also important to prevent a recurrence of this pandemic, to take steps
when we remember
immediately.
The impact of this pandemic, it's not enough to just remember the lives lost or the impact on jobs and lost businesses. We have to also commit to preventing this from ever happening again. And there are steps we can take. And New Democrats are committing to making that happen. Thank you so much. Merci beaucoup.
The honourable member for Sandwich Gulf Islands is rising on a point of order.
Merci, Monsieur le Président.
Thank you, Mr. Speaker. I am seeking unanimous consent on this occasion to make a little speech today also. All those opposed to what the honourable member is proposing will please say nay. Okay. The House has heard the terms of the motion. All those opposed to the motion will please say nay.
The honourable member, l'honorable député de Sandwich Gulf Islands.
Merci, Monsieur le Président.
Thank you, Mr. Speaker.
And
I'd like to thank all my colleagues here in the House, as well as those joining us virtually, like I'm doing. Today, on this day of commemoration of all the lives we've lost in these terrible times, we now have over 20,000 Canadian men and women who've lost their lives because of COVID-19. For each individual, for each family, we all share the same feelings as those who've already spoken this morning. And I'd like to thank the Prime Minister for his words, as well as the leader of the official opposition and the leader and the member for Belleuil-Chambly and the leader of the NDP.
I don't want to try to throw more thoughts into the chamber this morning, other than to say we all grieve. We grieve a very difficult year, and as many members have said, for some people more difficult than for others, for our seniors in long-term care homes, for marginalized people, for Indigenous communities. But it's hard to do a list without leaving someone out. I wanted to think about the moments where we were at our best through this last year. I think the first few months of the pandemic, we displayed virtually no partisanship. I can clearly remember, of course, that every bill that was passed up until September, we passed unanimously. But particularly those first 3 months, those first 3 or 4 months, voices on the phone, listening to daily updates and briefings, which happened on Saturdays and Sundays as well from our civil servants. You couldn't tell when someone opened the microphone to ask a question if that voice was a conservative voice or a Liberal voice, a Green voice, a voix de Bloc Québécois, or an NDP voice. We were all saying the same things. Can we get help fast enough? Can we help people? Can you please regard the credit unions the same way you look at the commercial banks? Can we please do this? And I want to call to us because while we commemorate a year of COVID-19, it's very clear it isn't over. Our ability to get through this and to save lives depends on us bringing back the best of ourselves and setting aside partisan advantage. I know it's deeply baked into our DNA to try to take shots on both sides, government, opposition, whatever. But please, Canadians don't want to see us trying to gain partisan advantage, thinking about an upcoming election. They want to see us work together, and that means provinces, the federal government, political parties here in Ottawa. In looking for empirical evidence through pandemic, which we do, we look for the science, we look for the evidence. Those countries that have done particularly well through pandemic have been marked in the media as those led by women leaders. I want to mark one other thing, and this is about not scoring a political point myself, but making a point about political culture. Those countries that have women leaders have another thing in common. They don't use the first past the post voting system. Our voting system encourages gotcha politics. The system of awards, reward and punishment for conduct goes towards rewards for doing the mean thing, reward for finding the dog whistle, reward for the wedge issue. Now's not the time for that. Even though we still live under first past the post, I urge us to behave and to judge our conduct as though we didn't, to pretend that we really are able to say we collaborate today because we know we can collaborate tomorrow and it won't hurt us at the polls. We need, for however long this lasts, to bring out the best in ourselves, as we did at the very beginning of the pandemic, when we set partisanship aside. I love you all individually and collectively. I really, truly do. We have to do this together. There's no other way. We're now in a race between vaccines and variants. We have people who will be safe soon from their vaccinations. We have people who are still at risk. And our society as a whole, our ability to triumph over adversity, that we will mark best when we conduct ourselves in ways that suggest there are no parties here. God bless you. Thank you.